Hello and welcome to Health 360 Plus. This is our digital broadcast. We're live right now on all of India Today's digital platforms, Twitter, Instagram, Facebook and YouTube. Our conversation today is going to be on the increase of COVID cases in the country. Cases are surging. The questions that everybody is asking right now is that what should be done? Is a fourth dose needed at all? Those who have not taken the third dose, do they need to go ahead and take it? What should senior citizens do? Should they not go out? Also, should one mask up? That's the most common question that everyone really is asking. Should there be a ban on religious gatherings? And should people exercise any other precaution that they have not been doing so in so many months? To answer all of that and much more, I have with me Dr. Randeep Guleria, Chairman of Institute of Respiratory and Internal Medicine, Medanta Hospital, and also somebody who's been the most credible voice during the course of the pandemic in the last 3 years. Dr. Guleria, thank you so much for joining us and
Thank
sparing
you.
time for us. I want to begin by asking you, sir. Many people say that the government of India doesn't say mask up. So why should we wear a mask right now? What is your advice about masking up?
So I would always say that prevention is better than cure. And as we are seeing an increase in number of cases, there is always a reason that this could spread more and especially cause severe illness in those who have comorbidities and those who are the elderly persons. Therefore, masking, especially for those who have comorbidities, who are elderly, especially when they're going into a crowded place or when they're outdoor or in a room which is not well ventilated, is important because if they get the infection, it can be more troublesome and it can actually cause more severe disease requiring hospitalization and ICU admission.
So in indoor spaces as well, for example, in my office, should we wear a mask? Should we get back to masking since it's an indoor space?
So if you have an indoor space where there is a lot of people, so if there's a crowded indoor space and there is not good ventilation, so there's no good ventilation, then I think it's better that if you have a crowd that you wear masks or try and maintain some degree of physical distancing, wash your hands regularly, use a hand sanitizer. If you take these precautions, you could prevent yourself from getting the infection and taking it home, and then someone at your home who has comorbidities could get the infection. So it's basically to prevent yourself, to break the chain of transmission, and also to prevent the infection spreading to your family members.
Since we're talking about masks, we've always said during the pandemic that N95 masks are the best, and then second come the surgical mask, and then last come the cloth mask. What do you have to tell about people who do the opposite? Many people go in for cloth masks, some just wear a loosely fitted surgical mask. The importance of a well-fitted mask, how significant is that?
So I think if you are going to wear a mask, it's better that it's well fitted. I would say that currently a surgical mask or an N95 mask is what one would recommend. And you have to make sure that it's tightly fitting and covering both your nose and mouth. And there's no air going in from the side of the mask. If you wear a mask and it's so loose that air, when you breathe in, air goes in from the side of the mask, then that filtering mechanism or the protective mechanism which the mask is giving will not be there. So if you have to wear a mask, wear it properly so that it fits snugly around your nose and mouth. And when you breathe in, you can feel the breath coming in, getting filtered through the mask, and then you're breathing in. It's not coming from the side of the mask.
You know, Dr. Guleria, there's been a lot of conversation about universal masking and how that really isn't allowed. My question to you has got to do with kids. Schools have started. Should children wear a mask and go to school?
So in an ideal situation, children should try and wear a mask. But if you look at a practical situation, it's going to be very difficult for children to wear a mask and be there in school because, as you know, children are sort of would be following these, let's say, orders or recommendations very loosely. And when children are playing or they're running around, wearing a tight mask becomes very difficult. What I would say is that especially if your child has fever, cough, cold, don't send the child to school. Keep him at home for at least 5 to 7 days so that he is not infectious. You may have a child who has infection. Parents send him to the school, just give him a paracetamol syrup and send him. And he's coughing, sneezing. He will then give the infection to many of his friends in the class, and they will then take it to their respective houses. And in that manner, the infection could spread to other people. So I think the more important thing is to try and keep the child at home rather than a sick child going to school.
Okay. You know, Dr. Guleria, a lot of people, if they're having cough and cold, They usually, what they're doing is that they're just as a precautionary measure not turning up at work. Uh, Many people are not going in for testing. Is that okay? Or you, because it's been 3 years, there is lethargy, people are not willing to go for testing. They're like, we're okay. If you're, if, even if it's COVID, it's like normal cold and cough, and we'll probably just be at home and it'll be okay. Are you okay with something like that?
So for the young, to some extent, it could work. And I know a lot of people who don't get themselves tested. I also know many people who get the rapid antigen test done at home. And then if they're positive, they will just inform the doctor, but not upload the data. Now, the reason why it's important to get tested if you have symptoms is to really know what is the burden or what is the number of cases that we're having as far as the disease is concerned. So it's not only from your point of view, it's from the public health point of view and from the data which the government needs to decide on what measures should it take. And is there a cluster developing somewhere? Also, some samples then go for what we call genome sequencing. So that gives us an idea whether there is some variant that is developing. Are we seeing a new variant which is emerging? So for all of that, it's important that people who have fever, cough, and flu-like symptoms get themselves tested. And we come to know what is the number of cases actually in the population that are having COVID infection.
You know, Dr. Guleria, the number of cases being reported now are 9,000, 10,000, around that many. My belief is that this is a gross underestimate. In your understanding, how many cases would there actually be in India right now? Though many say that we need to stop counting cases, but is it not important to get a realistic picture of how many actual new cases could be there in India on a daily basis, sir?
So I think it's important, and you're right that we are really underestimating the number of cases. It could be many times more than what we are currently testing, because as we just discussed, many people are not getting themselves tested, or if they do started and getting tested, also they're not uploading the data. So we really don't know how many people are actually positive. I think it's important, and it has multiple sort of benefits. One, like I've already said, that one should get tested so that we can really know what is happening as far as the number of cases are concerned. The other important thing to do is to do some testing which is basically hospital based. How many patients are getting admitted with sick illness and are COVID positive, and what is the type of presentation and manifestation that they're having. So one is a community based testing to see what are the number of cases. The other is a sentinel testing, which is hospital based, to see what is the number that is actually getting admitted. Are they having pneumonia? Are they having worsening of comorbid condition? Are they having some atypical presentation? That will give us some sort of a warning that is there a change happening in the presentation, in the severity of illness, and what should we do? Because, many people argue that if there are mild cases, we need not bother that much. My argument is that if there are mild cases, yes, we need not bother that much. But as the number of cases increase, the chances of mutation may be higher and we may get a new variant. Also, we must see how is the virus changing. We know that this virus continues to mutate. It mutates at least twice a month. So has a new mutation emerged which is causing more serious illness? That is something that we need to observe more closely, because I don't think we can really predict how this virus will behave in the future.
You are saying that basically Omicron is mutating almost twice a month?
The variant, the virus, the coronavirus mutates twice a month. Omicron is one of the sub variants of COVID-19. It does mutate at least twice a month, but many of the mutations are just variants of interest. The mutation has no significance as far as infection is concerned, immune escape is concerned, severity of illness is concerned, and therefore we don't bother much about it. At times when the new variant comes, it becomes a variant of concern. So it moves from a variant of interest to a variant of concern when either it is spreading more quickly, it is more infectious, or it has developed an immune escape mechanism so that people who've already got the infection again get the infection. So that is immune escape, or it has become more virulent. It is causing more severe illness, severe pneumonia or other symptoms. And we are wanting to monitor for that how is this virus behaving? And to do that, I think you need to be able to test and have an idea how to get data for this.
So you would still say that RT-PCR is the way to go forward because that is what exactly gives us an idea about the number of cases. Like you said, the more the cases increase, there is more mutation, and that's the reason why preferably go for an RT-PCR instead of an antigen.
Correct, because RT-PCR test also will give you an idea in terms of if there is a mutation, then that sample can also be used for genome sequencing. The rapid antigen test, which is a home-based test, is easy to do, but it doesn't really give you enough material to do go for genome sequencing and other testing.
Dr. Guleria, this is from the family of XBB, and that's the reason why the government also says that they aren't really, very perturbed. Given that XBB has been in circulation for a while now, they know that the severity will not go up significantly. Do you think that we are pushing this a little?
So I think there are two ways of looking at it. One is, like you rightly said, for more than a year now, we are seeing only variants of Omicron. Before that, if you remember, we used to see very frequently new variants coming. We had the Alpha, the Beta, the Delta, the Gamma variants coming, and then we had Omicron. But it seems that the virus has stabilized to some extent, and now we are just seeing variants or sublineages of Omicron rather than a dramatic change in the virus at the spike protein level to cause a new variant as we were seeing in the last 2, 3 years. So that does mean that this virus has stabilized. Also, our immune system now is better prepared to fight the virus, and that is why we are not seeing that severe illness. So people argue that we should be vigilant, but we shouldn't panic. We should do our testing so that we know what's happening, but it's not a cause of really, huge concern in terms of drastic measures. And if you want a sort of an opinion which some scientists also have, that if there is a mild infection, if it spreads, then it is also giving you natural immunity. So you are getting some immunity which is not from the vaccine but from natural infection in the community, and that is not a bad thing. So I think as long as we are vigilant, we monitor the infection and we treat aggressively those who have severe infection, and we are seeing that hospitalization is not going up, deaths are not going up, we should not panic, and we could be in a comfortable situation.
Dr. Guleria, you did say deaths aren't going up, but India, for example, has reported again today 27 deaths. The deaths over the last few days have been above the 20 mark, essentially, more than 20 deaths being reported. What I want to ask you is this the outcome of the cases increasing, and in that sense, the number of deaths is proportional to the cases? And is there nothing to be really worried about?
So I think what has happened is that the number of testing has increased, and testing in hospital has increased a lot, and especially for those who are admitted in the ICU. Many people who are dying are not dying because of COVID infection, but the comorbidity which has worsened because of the COVID infection. Like in the Delta wave, we saw a lot of people who presented with pneumonia, decrease in oxygenation, ventilatory requirement. Now we're seeing people who are coming with comorbidity, they are getting admitted, and the death rate is actually because of the associated comorbidity, which is also contributing to the death. So I think that is why the concern is there. We need to treat these patients aggressively because every life matters. But at the same time, we must accept, and we know that from influenza also, that every year some people will get severe illness, especially the elderly and those who have comorbidities, and there will be some deaths because of viral infections.
Is COVID in India already in the endemic stage, or are we moving in that direction, or right now we feel we are in an endemic stage but things could change?
So I would say that currently we are more or less in the endemic stage. We are seeing cases, and there will continue to be a number of cases. The virus is not going to go away. COVID-19 is here to stay. It will become an endemic virus like some of the other members of the family, and they will continue to cause flu-like symptoms, and pneumonia and serious illness in a few patients. But by and large, it will cause a flu-like symptom that we tend to see with other respiratory viral infections. So we have reached a stage of endemicity as long as the virus doesn't change dramatically. So if the virus changes dramatically and we get in a situation where it becomes more virulent or it develops an immune escape mechanism causing more severe infection, then we could have a little bit of a surge. But my own personal feeling is that we will see some small peaks happening over the next few months or years, but we are not going to see the type of peaks or the types of admissions that we saw in 2020 or 2021.
Dr. Guleria, a lot of people have not taken the third dose of the vaccine and are choosing not to. Should everybody take it? Should just the vulnerable take it? What about kids? What's your advice on vaccines as far as the third dose is concerned?
My advice is that everyone should at least take the third dose, the booster dose, especially if you fit into the category that you need it. Most people now should take it. The booster dose uptake has been low because people feel that now COVID is not that much of an illness. But I would just say that it's always better to have a good immune response to the virus because it decreases the severity of illness, prevents long COVID from happening. And therefore, if you have not taken the vaccine, I would advise people to take the third dose as far as the booster dose is concerned.
All right. Essentially, we are going back to the basics. You're saying that we should take the third dose and also we should mask up. Uh, that is something that we must be doing. What I find odd nowadays is a lot of people using thermal scanners. And I personally don't really believe in that because a lot of us are, of course, asymptomatic or we may be in a pre-symptomatic stage and that thermal scanner will not catch the fever. Many of us may not even have fever. You think thermal scanning makes any sense?
No, I personally feel, and I've been saying that even during the last 2 years, the thermal scanners are of no use. The sensitivity and specificity in picking up someone having fever is very low. At the same time, like you rightly said, you could be asymptomatic or you could have no fever, but you could still be infectious and giving the infection. Therefore, using thermal scanner just to screen people currently, I don't think has much use, and it's really of not much benefit having thermal scanners outside building and people going through that in terms of deciding whether they have fever or not.
Dr. Gulere, we have a question from a viewer. Abhinav Chadda says, is dwindling protective immunity obtained from COVID vaccines playing any role in the sharp rise in COVID cases?
So we need more data on that. There are two things. Our immunity is based on two factors. One is the vaccine-related immunity, and the other is immunity because of natural infection, which has also happened in many individuals after the Omicron variant. So to say that now the immunity has come down significantly because it's been more than a year since people took the booster dose is something that we need more data. We need to see what is the antibody levels in the blood of people who have had the vaccine and what is it now. Secondly, we also need to see how effective has the previous vaccine been against the new variants as far as efficacy of the vaccine is concerned.
Okay. We have another question. The username is new normal. His or she has not identified herself. Should we immediately go for testing in case of fever is the question.
So if you have fever, remember fever can be because of a large number of conditions. It can be because of even other infections, including typhoid, malaria, dengue. If you have fever, but associated along with that, you have flu-like symptoms, sore throat, cough, running nose, body aches, headaches, any one of them, then you should get yourself tested. But just having fever alone is not enough. You could have fever with symptoms which may be suggesting other infections. If you're very concerned or someone in the family has had a flu-like illness and now you're having fever, then you could get yourself tested.
Dr. Gulere, some people are asking me. Honestly, it's almost like trolling me on the fact that we are not talking about vaccines and the kind of impact they can have on our health. A lot of people have already linked it to the so-called rise in cardiac ailments that we're seeing in people. A lot of cardiologists that I have spoken to say that there may or may not be a rise. We may be just reporting these things more aggressively now. It's the era of social media where any video is just put out, and there is no drastic increase in heart ailments of people, and it's too premature to link them with the current vaccines. What is your take on this? On both the vaccines that we've taken in India, there are more than one, there are more than two actually, but predominantly we've taken the two vaccines made by, one of course is the AstraZeneca version here, and the second one is the homegrown vaccine, and the link with heart ailments, so to speak.
So majority of people have had the Covishield vaccine, which is the AstraZeneca vaccine, and the others have had Covaxin, which is basically the Bharat Biotech vaccine. So my own take on this is that we don't have enough data one way or the other. So there doesn't seem to be very strong evidence to say that a large number of cases are there. Yes, all vaccination and all therapies do have side effects. Whether this is a minor or a rare side effect is something that we don't know. I would really say that we need to collect more scientific data to really see whether there's a cause and effect relationship. Like you rightly said, people are reporting it. But can we link it to vaccine, or would it have otherwise also happened if people had not taken the vaccine? So I don't think we can say one way or the other that these cardiac ailments are vaccine related. It could be just that awareness has become much more, and that is why we're picking them up. But to say that they are caused by vaccine, we need more data.
You know, Dr. Guleria, there are a lot of people who give this anecdotal sort of, information about how they're feeling after COVID, how they're feeling after many years also. You know, in India, and my question has got to do with what the government is doing, do you think there needs to be much more work done in the area of long COVID? And that the next 5 years or so, we're going to be woken up from a slumber about the long-term impact of this infection?
Yes, I think we need to do research on long COVID. I'm aware that ICMR already is doing a number of research projects to look at long COVID. There are two or three important things to remember. Long COVID is a multi-system issue. People can have respiratory problems, cough, breathing difficulty, but some people can have body aches and fatigue, lack of concentration, brain fog going on for a long time. And therefore, to see what so we need to find out what is the risk factors, who's at risk of developing long COVID. Do we have a biomarker to say that this person can develop long COVID or has a higher chance of developing long COVID? What are the symptoms? What treatment should be given? Suddenly, currently, we are just giving symptomatic treatment. And then finally, how long will it last? So I think there is a need to do research on long COVID. This is something which will emerge over the next few months or years, and we will have more clear data on it.
Okay, we have a question from a viewer who's asking, mask or no mask in closed spaces like offices? That's something that I asked you, but like I said, a lot of people are very interested in this very basic precaution. So if you could just throw a little more light on that, Dr. Guleria.
So if you are sitting in your office and you have your window open and there's good cross ventilation, you may not need to wear a mask. But if you're sitting in a room which is totally closed and there is a large number of people there, then it's safer to have a mask, because let's imagine you're sitting in a closed room which is not well ventilated and someone there has COVID and it's coughing. Then the virus will come into the air and it will stay there as a droplet or aerosol for some time. And if you were to cross that area, or that person was to cross your desk, he could give you the infection and you could get the COVID infection. Therefore, in a closed area where there is not good ventilation, the chances of getting infection from another person is high. And that is why one really advises masks to be worn. If you can't do that, I would say just keep your window open and let there be good cross ventilation.
Okay. Dr. Guleria, since everybody is very interested in masking up, I just want to ask you this one thing, that it's uncomfortable. I know at the end of the day, wearing a mask for long hours is not something that we ideally want. But there are just so many benefits of masking up, isn't it? In a city like Delhi and the NCR region where we are, pollutants N95 offer good amount of protection, not just against COVID, but bacterial infections also, tubercular infections. These are some things that can be prevented, droplet infections, if we are masking up, isn't it?
Correct. So if you look at masking, and this is something which is done a lot in East Asia, masking prevents you against a lot of respiratory infections, including other viral infections like influenza. It also protects you against tuberculosis, which is another droplet infection. And in cities where air pollution is high, masking also gives you some protection against the particulate matter which you may inhale and cause airway inflammation because of air pollution. So wearing a mask has multiple advantages. It's uncomfortable. So like I said, if you are indoor, if you're in your own house and you are or in a well ventilated area, you could take it off. But if you have a situation where the chance of getting infection is high, you're outdoors where pollution level is high, wearing a mask actually would make more sense.
Okay. We have a viewer on Instagram, Chetu Akula is asking, how severe is the new COVID?
So as of now, the new COVID is not that severe. It's not causing a large number of admissions in the hospital or in the ICU, or even a very high mortality. It is usually a mild illness, but there are some people with comorbidities, those who are elderly, who are getting a more severe illness requiring hospitalization. So if you were to look at the previous waves, the first and the second wave, as compared to that, it is a much milder illness. But like I said in the program in the beginning, We need to be vigilant and be careful and take preventive measures, but we don't need to panic.
Traveling in AC coaches must require masks, sir? Uma Shankar Patra is asking this question.
So if you're traveling in an AC coach like a metro, which is got AC and it's a crowded place, wearing a mask would be a better option because again, getting the infection is higher. A lot of ACs use what we call uh, recirculating the air. It's not that the air goes out to maintain the temperature, and therefore chances of infection are usually high. If you have an AC which has a duct and fresh air keeps coming, then chances may be low. But I would say that if you're traveling in an AC coach, a safer option would be to wear a mask.
All right, Dr. Gulede, I'm going to thank you for joining us and sharing your views with us on that very important topic of discussion. COVID-19 is back in news again because cases are surging. Positivity rates are increasing. In Delhi, it's almost touched 30%. In India, on a national average, it's almost at 9%. Basic precautions must be taken. It really is time to go back to the basics, is the sense that we get from Dr. Randeep Gulede. Like I said at the very outset, the most credible voice on the pandemic that we have seen in the last 3 years or so. Dr. Guleria, thank you for connecting with us. Viewers, thank you for joining.
Thank you.